Your girl is here.
For how long have you been licensed?
Since 1991 or 6.
1 or 6?
I think it was 1996 when I was licensed in North Carolina.
With your undergraduate studies, Dr. Moore, could you please tell the jury a bit about your educational background? I know you mentioned a little bit of it just now.
So I attended University of North Carolina at Chapel Hill, graduated in 1987 with a BS in biology. I went on to medical school at UNC and I graduated in 1991. I then went to the hospital at the University of Pennsylvania
What the hell is she wearing?
I did a 5-year orthopedic surgery residency there. And in 1996, I went to
Is it Dr.
University
Quinn
Medical
Medicine
Center and
Woman?
did a year of fellowship in hand, upper extremity, and microvascular surgery.
We're pirates here.
And on completion of my fellowship, I was invited to join the faculty, and my role was hand and trauma, and so I went to Los Angeles for about 6 months for a preceptorship in pelvic trauma,
Okay, so
and then went back to Duke and practiced as a director of the orthopedic trauma service and a member of the hand, upper extremity, and microvascular reconstruction team until 2000 when I relocated to North Carolina, to Wilmington.
And you maintained an active clinical practice since
this
2000.
is Amber's witness.
And before that, when you were at Duke, correct?
And I guess he's
Yes.
going to say Johnny Depp cut his own
Just
finger
very
off.
briefly, can you tell the jury what is a residency?
You know, as you do.
Residency is largely an apprenticeship. So when you finish medical school, you have a MD medical degree, but you really can't practice medicine, and you take a tract of internal medicine or pediatrics or OBGYN or orthopedics, and then it's a graduated training
Everyone knows
program,
this.
anywhere from 3 to 5 or 6 years.
And what's a
It's 10
fellowship?
years to become a doctor.
And a fellowship is a year beyond training. When I completed
Just
my
leave it at
residency, had I chose to, I could have practiced as a general orthopedic surgeon. But I wanted to subspecialize, and therefore that required an additional year of training.
She's just on the prairie.
And I believe you mentioned this, but your subspecialization was in the hand. Is that right?
That's correct.
Why did you choose to specialize in the hand?
Patient population,
Yeah, that's how
the types
everybody
of
does
problems
that.
we treat, and the anatomy is really the biggest reason I chose it.
I'm not trying to interrupt, but
I mean, for lack of a better term, it's really pretty beautiful anatomy.
And let's talk about that anatomy. There's bones in the
there are
hand, right?
bones in the
Correct.
hand.
And then there's tissue and blood vessels, right?
Objection leading.
Overruled.
Oh, my girl is on
I'm
it.
sorry, you can go ahead
She's
and answer
on
that.
it.
Yep,
She's
that's correct.
And
On the buzzer.
What is the surgery called where you operate on tissues and blood vessels in the hand?
Well, that would be hand surgery. I mean, there are different components of it. There's trauma where we do repairs of tendons or blood vessels. There's a microvascular element where we repair injured nerves.
But did he treat Johnny Depp?
In my practice at Duke, I was on the replant team, and so
We're just talking about his
we would
career.
do replantations when digits were cut off. We would try to reattach the bones and tendons and nerves and
cut
vessels
off.
to
Okay.
reattach the digits, and hopefully I'm survive.
And have you performed surgeries of that nature?
Yes.
When you perform
They're
surgeries
so
of that
nervous.
nature, what
They're
assessment
not
do you make of
confident
the
at all.
cause
They're
of
just
those
like looking.
injuries?
So cause is a big element. It's an important element to appreciate because it can impact management in a lot of those settings. You know, there's a difference between a laceration caused by a razor blade and a laceration caused by, say, a serrated knife. There's a larger zone of injury. So what we anticipate having to manage is based on how the injury was created. There's also other elements, contamination. You know, farmyard injuries are totally different than clean injuries, and kitchen injuries with raw chicken are totally different than some other settings. And so it does play a large role in management.
I think this goes without saying.
After your fellowship at Duke University, I believe you mentioned you had another role at Duke.
Duke is a good
for
school,
a few
but,
years.
like-
Is that right? Can you tell the jury about that?
So I did my fellowship and I joined the faculty as an assistant professor, and so I was in charge of teaching residents and fellows. I was the director of the orthopedic trauma service, and I was on the hand call team in addition.
Have you had
The hand call.
academic appointments at any universities other than Duke?
I have a adjunct assistant professor appointment at the University of North Carolina at Chapel Hill, which has affiliated training programs in the center where I
Okay, so you
practice
haven't
at.
left North Carolina. We
Have
get
you
it.
held any leadership positions in your field?
I've been an officer and the past president of the North Carolina Society of Surgery of the Hand, the Duke Hand Club or Society now.
Just Duke and hands. Duke and hands.
I'm a member of the American Society of Surgery of the Hand, of the Orthopaedic Trauma Association, of the American Academy of Orthopedic Surgery, and of the American Orthopedic Association, the AOA.
Are the majority of your surgeries hand surgeries?
Yes.
How many hand surgeries, ballpark, would you say you've performed in your career?
Over 25 years, thousands.
Have you seen finger injuries similar to the one sustained by Mr. Depp in Australia?
Yes.
And have you evaluated injuries like that?
Yes.
Have you treated injuries like that?
Yes.
Have you operated on fingers that looked like that?
Yes.
How many times? Ballpark.
Hundreds, if not more.
What does it mean to be board certified in your field?
Oh my God! Well, we know what
board
it's
certification is a process that that you pursue after you complete training. So at the time, there have been some changes, but at the time that I finished my training, after
don't
residency,
care.
we took a written examination. And if you
Did
passed
you
the written
operate on his
examination, you had
hand?
to practice for 2 years.
Is it
At the end
because of
that
you
2
that he
years,
got
you
the
submitted a list of
what is it
cases
called
over
again?
6 months to the board.
The
and they
Mercer
picked
or whatever
12 cases, and
infection?
then you gathered up 10 and went to Chicago and had an oral
I can't talk-
examination
I
based
can't-
on
I
those
can't.
cases. And if you passed the oral examination, then you were board certified.
And your board certification is
We don't know who cut off the finger.
Orthopedic surgery.
What is a certificate of added qualification?
So in the
I think it would have been a
event that
mistake
you
whether he
elect
cut it
to-
off or whether she cut it
to
off. I
do a
don't think either of
fellowship
them
in
meant to cut it off.
subspecialized hand surgery
If they
is
cut it
one
off,
of the-
either
the,
of them. But it
specialties
was cut
that,
off. Let's move on.
You can apply for a certificate of added qualification. And so once I was board certified, I practiced for an additional year or two, had to resubmit a list of cases and take a written examination to become certified in hand surgery.
Do you teach other surgeons how to do hand surgery?
Occasionally.
My
on occasion,
God.
yes.
Now he's a
When was the
professor.
last
he's a
time you did so?
We know he's a professor. Though he already said
Day
it.
before yesterday.
Tell the jury about that.
I
Okay, and
was
he's working in the
over the
field, so
weekend.
that's good.
I went to Miami to serve as faculty for a course, a bioskills course we call it, on shoulder and wrist surgery. And surgeons come in and we have case presentations and panels, and then they had a cadaver lab, and we were able to allow them to perform the surgery in cadavers to become familiar with the equipment.
Have you published in your field
I have.
in peer-reviewed literature?
Yes.
Your Honor, at this time, we'd like to offer Dr. Moore as an expert in the field of orthopedic surgery and
Oh
specifically
my!
hand
So
surgery
all of
and
that
injuries
was just
to the
laying
hand.
foundation that
objection?
he's
No objection, Your Honor.
qualified. So can't they just read a resume and qualify him
Now
before he gets there?
We get to talk about this case.
He's a
At our
late witness.
request,
He must be a late witness.
what have you reviewed, just general categories of information, have you reviewed at our request in this case?
So a tremendous amount of material. I reviewed the video deposition and trial testimony of Mr. Depp regarding the injury, the medical records from Australia, the photographs of the injury from Australia and Los Angeles, texts and emails, the deposition of Dr. Kipper, and I'm sure there's more.
And when you reviewed the deposition of Mr. Depp, was that just in paper form?
It was a video deposition.
And so what did you review of that deposition?
The section where he describes the injury.
And did you see a video of him describing it?
I did.
And you watched the testimony from this trial of him describing it?
Yes.
And you mentioned that you reviewed some texts as well. What are those?
Text will help
there were
him.
there were
Make a
there were
diagnosis.
communications amongst Mr. Depp and his physician and others.
If they want to waste their time, they can waste their time.
And what did you specifically review in those texts relating to the finger injury?
Well, with relation to the finger, there was a text where he had stated he cut his finger off.
Now, Dr. Moore, I'm going to ask you some questions
Which he said he
about
did to
this
protect
case
her.
regarding the opinions that you formed relating to Mr. Depp's finger injury.
We can all read text.
When
We can
I
all read.
ask you those questions, do you agree to answer my questions to a reasonable degree of medical probability?
No,
Yes.
you can't,
And do
because you would
agree to
never
advise the jury
have
and
been
the
his
court
doctor.
if you are not answering any of them to a reasonable degree of medical probability?
Yes.
Dr. Moore, based on your analysis, did Mr. Depp's finger injury happen as a result of a vodka bottle being thrown at him?
Objection leading.
Overruled.
I'm sorry.
No.
And what is the basis for that opinion?
Well, the medical data is inconclusive. It's not consistent with what we see in the described injury pattern or in the clinical photographs. And there are several elements. There's the description was of the hand being flat on a bar and the bottle crushing the finger from the top. But looking at the images, there's really no significant injury to the dorsum of the finger, and to create the type of injury with that type of a crush injury, we would anticipate both injury to the fingernail and other parts of the finger.
Can I stop you there and
Sure.
just break down a few things? You said the hand resting flat on the bar. Can you show the jury what direction the hand was resting based on the documents you've reviewed?
I think that the demonstration was with the hand flat.
Yes, yeah.
Like this, across and maybe even curled over
Johnny's
the edge
like-
of the bar like this.
Which side was facing upward? Which side of the hand?
Back of the hand, or we call it the dorsal surface of the hand, was up.
How does he know this? Was he
Closer
there?
to the microphone.
As Johnny would say.
Sorry.
Were you there?
Thank you, Your Honor.
Look at his face.
So
He's like, Johnny's face
you
is like,
referred to the back of the hand
How
as
you-
the dorsal side of the hand, is that
That's
right?
correct.
Sort of like
Are
the
you
dorsal
psychic?
fin on a shark?
Correct.
oh, the dorsal.
And-
It's too much.
What is the other side of the hand?
He's laughing.
The
Look.
palmar surface.
Palmar? Okay.
He knows this is absolutely
So
nonsense.
what direction was Mr. Depp's hand resting on the bar?
So the dorsal side was up, which with the descripted mechanism of injury or the injury, the bottle would have struck the top of the finger at the fingernail.
And you also mentioned a term that I'd like you to explain to the jury, crush injury, please.
So with review of the images and the X-rays, I mean, this was a crush injury. That would generate the findings clinically on X-ray that we saw. The fracture is a we call it comminuted, and the tip of the finger is in multiple splinters, so there are multiple fragments, and typically you see that with a crush type injury.
So a comminuted fracture is one where there's multiple fragments of bone.
And look at
That's
his
correct.
face. Johnny's face is
And
like convoluted,
what was
but
the
you don't know
basis other
anything.
than
My uncle
what
won't
you've
even.
read and heard, but from the pictures, what was the basis?
And my uncle is an amazing
of
dermatologist.
your opinion that
but
the,
he won't
the-
even advise
the
me
hand
over the
was resting
phone or
palmer
like.
side down.
Even if I send him pictures,
Well,
like
that
he
was
has
the
to
way
see
the
me.
injury was described.
So how is this man sitting
and
here doing this?
demonstrated in the
And that's my
videos.
uncle.
And so, in that position, were the bottle to strike the finger the way it was described, it would have struck on the nail.
Would it have definitely struck on the nail though?
And the nail
Could
was
it have
really
struck on his bottom?
not injured, and so that's not consistent with that
spun around
pattern
and
of
put his
injury.
bottom there? Then it could have struck on his bottom. No.
Michelle, could I get you to pull up
I'm
exhibit
just so over it.
DX 369, page 26? Your Honor, this is admitted. Ask for permission to publish.
Yes, sir.
I dressed up for this doctor.
Thank you, Your Honor.
No, I didn't. I dressed up for Johnny Depp.
Dr. Moore, is this one of the images that you reviewed?
Yes.
I'm
Tell
so-
us
I'm
in
so
relation
queasy.
to your expert
I come from
opinion
a family
on
of
the
doctors,
cause of
but I
Mr.
cannot
Depp's injury.
see, like,
Tell us what you see in this
I don't
picture,
have that
please.
gene. I can't see blood.
So this is a
Whee!
it looks like an avulsion type injury where tissue's actually pulled or pinched away. what's important in this picture is that the tissue loss is on the palmar aspect from underneath the finger rather than all transversely in the finger, which you would anticipate if the bottle struck the finger. You would expect more of this level of injury rather than isolated to the palmar aspect.
And what do you notice about the condition of the fingernail in this picture?
So from this image, the fingernail appears to be intact. You can't necessarily see the entire nail, but there are other images that have a better profile of that. And the nail's not elevated. There's no subungual hematoma beneath it, or there's no bruise underneath it. Anyone that's ever stuck their finger in a drawer or caught it in a car door or hit it with a hammer knows that almost immediately there's typically bleeding underneath the nail, which creates this hematoma.
So,
and why are they
not being a doctor,
squeezing the
I'm gonna
finger?
try to,
It's injured and there's
summarize what you just said. Are you saying that in an injury like this,
life out of it?
if something had come from the top, that there would be an immediate impact to the fingernail bed?
That's correct.
Michelle, could you please pull up Plaintiff's Exhibit 144? Your Honor, this has been admitted as well.
All right. Thank you.
What's the name of that
Dr. Moore, I
infection
believe you
got?
mentioned
You
just
get
a
in
few
hospital.
minutes ago that there
No,
were other
please.
pictures that
Do
showed
we really? Are we really doing
more
this?
of the nail. Is this one of those pictures?
Yes.
And explain to the jury. Again,
And he has
I'm
very
sorry
nice
for the
hands as well,
graphic
Johnny
nature
Depp.
of this
I
photo,
noticed
but
that
it's
about him. He
important
has
that
very
the jury
nice
understands
fingers.
the basis for your
Like nail
opinion
beds and everything.
that a bottle couldn't have caused this coming
It's
in from
very graphic, yes.
Yeah. So again, the mechanism described would have almost certainly led to severe nail injury. I see no subungual hematoma. Again, it's a palmar tissue
I'm
loss.
feeling nauseous.
And the loss is from distal to proximal, which is from the tip back.
And I have
far
spaghetti
below
to eat
the
for
nail.
dinner
And so for it to
with red
to create
sauce?
that tissue loss down there would almost certainly have to be
Devastating.
injury dorsally with that described mechanism.
So what you're saying is that something coming from the top could not have left the nail intact.
Yeah, this is
and
all
yet
completely a
caused
waste of
injury
time.
from the tip of the finger underneath the nail.
Objection leading.
Overruled.
You can answer.
So
compound.
I believe that with the mechanism described, that if
She shows that a
the
compound.
bottle struck the
It would
nail,
be sustained.
there would have certainly been an injury to the nail bed.
This guy, I don't
And in
like
order
it.
for the soft tissue injury to be created by that mechanism, there would have almost certainly been tissue loss on the top of the finger as well.
Does Mr. Depp's description of what happened line up with the undisputed photographic evidence that you've reviewed?
No.
Or not.
Now, we
You know what I
mentioned
mean?
the term crush injury a few minutes ago.
Yeah, so
I'd
was
like
it
to
crush
show
or not?
you DX360, please.
So
And Your Honor, this is, we won't publish this at
it's
this
not
time.
a sliced off.
Is this a document
So it's not a
that you
slice off
reviewed
like
in
what
connection
Amber is
with your
trying to say?
expert opinion in this case?
Yes.
And Michelle, if you can please go to pages, I believe they're 5 and 6. Your Honor, I would ask for permission to publish these as a demonstrative.
That looks
Jury.
like some
Page
like
5 and 6.
kind of
sorry,
forced
sorry,
trauma, like something hit
09
his
and
finger.
10.
This is what's convincing me
Page
that he
2.
didn't do it himself, because it looks like
Go to 10
some kind of
also,
like
so plaintiff
something
can see
hit his
any objection
finger.
to 09.
No objection, Your Honor.
as
09 or
opposed to
10 can be
slicing it himself.
published.
It doesn't look sliced.
Dr. Moore,
Especially
what
the
are
kind of
these
knives they
pictures
have.
of?
They have chefs
So
and
these are X-rays
good knives,
of
you
the
know.
injured digit.
And what do you observe in these X-rays? Explain to the jury what you see.
So these are two views. So one in the plane looking through the finger in this direction, one in the plane looking through the finger sideways. And you can see that the tuft or the tip of the finger, the last bone in the finger called the distal phalanx, is shattered. You can see there's multiple little spicules of bone. And there's also a transverse fracture at that level, which runs through the bone. So this is what we would describe as a comminuted
Like it was
fracture, and it's
crushed
commonly
by a
associated
bottle.
with crush injury.
In your decades of practice, Dr. Moore, have you ever seen a comminuted fracture like this
So how he
result from
crushed
an
it?
object thrown in the way that Mr. Depp described?
Well, not with the constellation of findings shown on the X-rays. I mean, I think that could create a fracture, but in this setting, it wouldn't create a
Constellation
fracture
of
with
findings?
without the associated other injuries that we would anticipate.
And in your decades of practice, when you see a common
So that's a yes for me, dog. That's a yes for
What
me.
are some things that have typically caused it?
So crush mechanisms
Convoluted
could be
constellation.
slammed in a drawer, caught between two logs in the fireplace, car door, sliding glass door. Those are
When you're
all
in North
the
Carolina, you
mechanisms
got them logs.
that squeeze the finger between two hard opposing
That man was-
surfaces
come on
could
now.
create this type of injury.
In the statements of Mr. Depp that you reviewed, how did he describe what happened to the alleged bottle when it hit the bar?
I believe he said it exploded, shattered.
If a bottle had exploded near his finger,
That sounds like crushing.
in the way
shattered-
that he
shattered his
alleges,
finger.
what would you expect to see in the documents that you have reviewed?
Well, I think that the physicians did a good job of documenting the presentation, the appearance of the wound. They did not document the presence of any glass shards, and there were no other associated injuries elsewhere on the hand.
And I just want to step back for 1 minute. Michelle, can you pull up the next page of the x-ray here?
That's interesting.
Thank you.
I feel like she bit
And
it
Dr.
off.
Moore, just before
That's
we
my
move on
opinion.
from
She
X-rays,
bit off his finger because she
can you, I
is
know this,
that
when it's blown up like
wild.
this, it's a little bit blurry, but can you point out or describe to the jury where the
She
where the
tutus on
multiple
beds.
bone
She can bite
fragments
off
are?
fingers. She bit it off.
So they're in the very tip.
Let's get
If, you know,
real.
if-
That's why
if you
there's no
see the
glass, it's her
joint,
teeth.
And then there's what we call the transverse fracture, which is across the middle of the bone in the same plane as the joint, and then the multiple fragments are in the tuft. With a Xerox copy, the quality is not as detailed as a true X-ray.
You can take that down, please, Michelle. Thank you. So back to
This
to
man
the
is such a
glass.
hillbilly.
In the records
He's a
that you
hillbilly.
reviewed, Dr. Moore, did you see
Nothing wrong with
any
that.
adjacent injuries? In other words, injuries to any other part of Mr. Depp's hand other than the tip of his middle finger?
No.
And is that observation consistent with the explosion of glass type phenomenon that Mr. Depp alleges?
Well, I think in the setting of a glass explosion like that, where there's multiple fragments and the tip of the finger's cut off, you would anticipate that there would be other lacerations.
Did you review the documentation in the medical records from the hospital in Australia?
Yes.
Did any of those providers report retrieving glass from the wound?
No.
What about any glass near the site of the injury?
No.
What about any glass in other parts of the hand?
No.
What about any glass in any of the other fingers?
No.
Is there any reference at all, Dr. Moore, that you've seen to any glass in the records that you've reviewed?
No.
And Dr. Moore, in your decades of practice, have you ever seen an injury associated with a glass explosion that was focused on the end of a single finger in the way Mr. Depp describes?
Well, not consistent with the clinical images and the findings in this case, no.
Have you ever seen an
Yes or
injury
no?
associated with an alleged glass
Yes or
explosion
no?
where
Because
no other
I
glass
don't think
was
that
found on
if you
any
have
part
glass
of the
and
patient's
Johnny Depp
body
himself
or
can see the
clothing or
glass,
anything?
that you wouldn't take it out.
No.
Like, why do you need to? And it was like a long time after too
And
that he
because
went to the
there's been
hospital.
talk of a-
Why wouldn't
of
you
a
pick?
glass
Have you ever
explosion,
stepped on glass and you just take it out,
Dr.
right?
Moore, there's
You don't just leave
seems
it
to
in
have been a
there.
suggestion that somehow glass may have sliced off
What
the
for?
end of Mr. Depp's finger. Is that what's going on here?
Can you just?
This wound doesn't really appear to
It
be
could have been in
a
there
sharp
before,
glass
and it was
laceration.
removed. Very
You referred
simple.
earlier to an avulsion, which is a term I had never heard before. Your opinion in this case. Explain to the jury what that is, please.
So often with crush injuries and we'll see tissue loss that we call an avulsion, or where the
Evolution.
tissue's actually pinched or pulled away,
An avulsion.
rather than,
Okay.
than sliced or cut. It's not uncommon with crush injuries to see that.
Oh.
In your decades of practice, Dr. Moore, have you ever seen an avulsion injury with a partial amputation that results from an object thrown from the top of the finger in the way that Mr. Depp describes?
No. Again, I think that the description differs from the clinical appearance on the images.
Well,
Michelle, can you please pull up Exhibit
I have made
369
my decision.
at page 12? This has been admitted, Your Honor.
and he's not
All right.
relevant
Follow to the
at
jury.
all.
Dr. Moore, you said you've treated thousands of hand injuries over the course of your career, correct?
Yeah,
Correct.
you can see that Camille is not.
What is that on Mr. Depp's hand?
She's unbothered.
So we describe
very
that as
calm.
a
Objection
Cool.
calls for speculation.
The picture just changed.
Sorry, page 12, please.
Okay. Thank you.
Thank you. What is that on Mr. Depp's hand?
So that's a plaster
I'm sorry.
splint.
Overruled the objection.
Okay, sorry, thank you. I'm sorry, please tell the jury what that is on Mr. Depp's hand.
So that's a plaster splint. A half a cast is how I sometimes describe it to patients, and it provides stability for comfort and to protect fractures in the course of treatment.
Is that plaster splint hard or soft?
What's plaster Paris? It hardens like a cast does.
Dr. Moore, does Mr. Depp's description of how his finger became injured line up with the facts that you've seen?
Can you see
No.
the lights? Probably
I
not.
have no further questions.
All right.
Thank you, Dr. Moore.
Cross-examination.
Thanks be to God. Okay, cross. Let's go.
morning,
It's
Dr.
Camille.
Moore.
Morning.
My fave.
You said you reviewed Mr. Depp's video deposition, is that correct?
That's correct.
And you said you reviewed Mr. Depp's testimony at this trial, correct?
That's correct.
And was that also a video of his testimony?
Yes.
And you testified that Mr. Depp demonstrated that his hand was flat on a surface, is that correct?
That's correct.
That's not entirely accurate, is it, though?
No, his description was relatively consistent in both, including turning and,
No.
and resting the hand
said
on,
no.
on the edge.
Isn't it true, Dr. Moore, that when Mr. Depp did the demonstration in his
He
deposition,
didn't say it was
showed
flat
that
though.
his
He said he
fingers were
grabbed
hanging
the,
over the
this is
bar?
the bar. He said it was like
Well,
that.
Even hanging over the bar, it still leaves the dorsum of the hand or the nail
Exactly. I
vulnerable.
just
That's
said
not
it.
my question, Dr. Moore. My question is, isn't it true that Mr. Depp said his fingers were not laying flat on a table, they were hanging over the bar?
Yes.
Okay. And in fact, you knew that when you made that opinion. Isn't that correct?
Well, I believe that as I demonstrated
And you
sitting
lied.
here, that I said that he had said they were slightly slightly curled over, I think was the description that I gave.
Your description in this courtroom was that it was laying flat, and
I
I think
don't
you've done
remember you
that now
saying
twice.
that, though.
But in your deposition,
I don't remember
you
you saying
testified
that.
his fingers were actually hanging over the bar.
Sure.
Isn't that correct?
Objection, Your Honor.
Right.
Misstates the witness's testimony. He clearly indicated they were curled, or could have been curled.
Overruled.
So that's a that's a distinction that perhaps I misstated in one of the two descriptions.
So you don't know what you're
However,
saying.
that's
So you
not
just don't know what the fuck
substantially
you're saying.
changed my opinion of the impact it would have